Well, so for our trivia today, a little anatomy lesson. How many bones are in the human hand? We asked you.
Don't say the answer yet. We'll ask the doctor.
Okay, because how many are in the whole body?
It's like 200 something. It's like 205, I think, something like that, around there.
All right, and we'll tell you the answer in a second. The hand is a very detailed piece of machinery, and it also has a lot of nerves, muscles, tendons, and arteries. So injuries are real common. In fact, 1 out of every 10 visits to the ER involves your hand.
Imagine that. 1 out of every 10, 10% to the ER is because of the hand. But arthritis is also common, and Dr. David Olson is a surgeon with Hand Surgery Ltd. He's here to talk specifically about arthritis of the thumb. Welcome, doctor. Nice to have you.
Good morning. Glad to be back.
I saw you when Tiffany was asking the trivia question today. You were over there kind of, I could tell you were thinking through your college days. How many bones are in the hand? Do you know?
Right, 27.
27
Correct.
is right. Woo-hoo!
I would hope you know that.
Yeah.
I had to stop and count them.
It makes it a very intricate piece of machinery, and that's why you guys have to go to school for so long, right?
Right.
Yeah. What about arthritis of the thumb? What exactly is arthritis?
Arthritis, arthro means joint, and itis simply implies an inflammation. So arthritis is inflammation of a joint, but there are lots of causes of that or kinds. There's rheumatoid arthritis, there's gout, psoriatic arthritis, infection. The most common is what we call degenerative or osteoarthritis, and that's going to be our topic this morning. That's the kind that can be thought of as being generally the normal wearing out process of our joints.
Okay, it happens in a lot of people. What are some of the symptoms? If somebody's feeling what, should they think it might be this kind of arthritis?
Symptoms, the most common, most important thing is that of pain, but there are lots of others. Swelling, tenderness, decreased range of motion, deformity, weakness, just to name a few.
I remember years ago my mom had surgery on her thumb because this part of the thumb, the kind of soft pad area, but there's a bone that kind of protrudes there, but it was huge. Why is it that the thumb and this part of the hand in particular is so prone to arthritis?
Correct, that's an arthritis at the base of the thumb, and an opposable thumb is a beautiful device. It's what helps to make us unique as human beings. But because of the wide range of motion that's necessary to get that, the instability that goes along with it, that joint tends to wear prematurely. And the other element is the long lever arm of that thumb. A pound of force down here is multiplied about 14 times. So a pound here is 14 pounds there. A lot of people have 20 pounds of pinch strength, and that 20 pounds translates to 280 pounds down here. It's a lot of force on a little joint that's about the size of a dime.
Right.
And you see problems at different spots. There's an end joint and there's a middle joint. What's the difference? And what problems do you see in each spot?
Right. Well, what I'd call the end joint for this purpose, this one in your thumb.
Kind of your knuckle?
Here, where it bends at the tip. Most common problems are that of pain and deformity. These are treated with anti-inflammatory medicine, injection, we treat everyone conservatively. If that doesn't help, the procedure that's done is a fusion of that joint. What a fusion means is taking out the joint surfaces, bringing those together, treating the thumb in a way that those two bones grow together to be one. If the joint's gone, then the pain's gone and you have stability. The other unique problem to this area, some people will get a mass over this end joint about the size of a pea, what we call a mucus cyst, that arises from the joint. They can be painful, get bumped and banged, they can open and drain, and a lot of times require surgical removal. The next joint up, the one that we refer to as a middle joint, is a little different in that the instability, the arthritic change there comes often from injury, old sports injury, industrial stress over a period of time, so that the joint becomes unstable. Now this joint, in order for the thumb to work well, we need stability and we need power of pinch. We don't really need motion, so a fusion will serve you very well. Again, we try to treat those people non-surgically when we can.
And then the base is right here.
Right.
The base.
This joint, the joint that you referred to, your mom having a significant enlargement, is a very common source of problem. About 4 out of 5 people are women that present with this.
Why is that? Why is it more common with women?
Well, that's a hard question to answer. I know they would like to have us believe they do more work than we do, and
It's
that's
true.
the reason. But it's a point I would never argue with my wife. The
Smart man.
reason more likely is that you're more flexible than we are. Your hormone balance that makes you more flexible, allows you to have babies and so forth, gives you more laxity of this joint, and that sloppiness, if you will, in the joint translates to more wear and tear.
I think it's really good information, and we want to mention that you have a website and a phone number that people can call, because I think if you have pain, if you have swelling, if you have that protruding bone there in that base joint, if
Or
you
a
have
cyst.
trouble, a cyst in that middle joint, if you have trouble with pinching in particular,
Right.
or even opening jars seems to be a frequent complaint, the
Right.
strength in the hand,
Right.
you should call Hand Surgery Limited. And here's the number on your screen that you can call for an appointment or a consultation, or to find out more about the location closest to you. It's handsurgeryltd.com, or call 414-453-7418. Great to have you on the show,
Yeah, thanks,
Doctor.